Hello everyone, welcome back to my channel. Today we are going to see about emotional and physiologic elements of death and dying. Birth and death are two aspects of life which will happen to everyone. Dying and death are painful and personal experiences for those that are dying and their loved ones caring for them. Death affects each person involved in multiple ways, including physically, psychologically, emotionally, spiritually, and financially. Death means the irreversible cessation of all vital functions, especially as indicated by permanent stoppage of the heart, respiration, and higher brain function. Although there are many theories about the emotional transitions encountered by dying people, the best known is Elizabeth Kubler-Ross landmark work entitled On Death and Dying identified 5 emotional stages experienced by dying individuals. The 5 emotional stages are denial, anger, bargaining, depression, acceptance. Okay, that means DABDA. Denial or no, not me. Refusing to believe a probable death will occur. There is initial reaction of shock. No, I do not believe it. That means a denial. Second stage is anger. Why me? Recognition of a loss or death. May become angry, frustrated, and irritable that they are sick. Why me? They anger at God for not allowing them to see their kids grow up, anger at the doctor's family, self, and blame everybody for his misfortunes. Stage 3 is bargaining or yes, but. The patient attempts to make deal with someone or something to prevent loss. They may negotiate with the doctor by saying, how can I get more time so I can live in my dream home, and so on. Fourth stage is a depression or it's me. When reality sets in about their near death, bargaining turns into depression. Realizes the death, looks sad by thought, withdraws from important relationship. And the final stage is acceptance or it's part of life. I have to get my life in order. When the dying have enough time and support, they can often move into acceptance. Realizes that the death is inevitable and accepts universality of experience. People with strong religious beliefs and those who are convinced of life after death can find comfort in this belief. Then death can involve fears that are physical, social, and emotional. Physical fears such as helplessness, dependence, loss of physical faculties, mutilation, pain. We have to provide comfort to the patient and relieving pain. Regular observation should be made and good symptom control maintained, including control of pain and agitation. Then other care such as attention to mouth care is essential in the dying patient, and the family can be encouraged to give sips of water or moisten the patient's mouth with a sponge. Then turning the patient, eye care, positioning to facilitate drainage of secretions. Social fears such as separation from family, leaving behind unfinished business. So, as we have to give social care to the dying person. The family prepare the family for the normal expected change, and if they have been prepared for death, families are less likely to be panicked and better able to be with their loved ones in a meaningful way. Then use therapeutic communication to facilitate their expression of feeling. Then allow presence of loved one and allow time to share with spouse and children his feelings, and allow him to complete his unfinished work. The next one is emotional fears. Emotional fears such as being unprepared for death and what happens after death. Asanas have to talk with the dying person and hear them. Then use your mind, eyes, and ears to listen them. Respond to his concern and appreciate the patients. Never force communication. Then honor their wishes even if you don't agree with them. The need for privacy. Acknowledge them and provide a caring touch or hand holding that offer a comforting message. Then interventions for fears, talk as needed. Then avoid superficial answer, that is it's God's will, like that. Then provide religious support as appropriate. Stay with the patient as needed. Work with families to strengthen and support. Physiology of dying, somatic death or death of the body, then series of irreversible events leading to cell death, then causes of death varies. However, there are basic body changes leading to all deaths. The basic body changes is common to all deaths, but the causes of death is vary. The basic body changes result in the death of all vital body system. First one is the pulmonary. Here in the pulmonary system, unable to oxygenate the body, assess for poor oxygenation, skin pale, cyanotic, mottled, cold. In dark skinned, assess mucous membranes, palms of hands, soles of feet. In the cardiovascular system, large load on heart when lungs fail, heart not getting needed oxygen, pumping heart not strong enough to circulate blood backups causing failure, leads to pulmonary and liver congestion. Then about blood circulation decreased as heart less able to pump, so the blood circulation will be decreased, may have a drenching sweat as death approaches, pulse becomes weak and irregular. If pulse relatively strong, death is hours away. If pulse is weak and irregular, death is imminent. Then combination of these events leads to cell death and death of the organism, that means human death. As pulmonary and cardiovascular system fails, other body systems begins to fail also. Then failing metabolism, okay, like pulmonary and cardiovascular system, metabolism also will be fail. Metabolic rate decreases, almost stopping. Then feces might be retained or incontinence might be present. The fetus might be retained or incontinence. Then failing urinary system, urinary output decreases, blood pressure too low for kidney filtration, further load on cardiovascular system due to increased circulating volume. Then failing nervous system, in the nervous system, decrease oxygen to the brain means decreasing brain function, sensation and power lost in legs first, then arms, may remain conscious, semi-conscious or coma stage. Then specific sensory decline, dying person turns towards light, sees only what is near, can only hear what is distinctly spoken, touch is diminished, response to pressure last to leave. Dying person might turn toward or speak to someone not visible to anyone else. Eyes may remain open even if unconscious. Person might rally just before dying. Further neurologic decline at death, pupils might react sluggishly or not at all to light. Pain might be significant. Assess for pain if person unable to talk, restlessness, tight muscles, facial expressions, frowns. Provide pain medication as needed. Then never lost sight. Death is the end as we know it for that person. We can only support, listen therapeutically and make the person as physically comfortable as possible. We can also use our knowledge and expertise to strengthen, support and prepare the family. The nurse has a responsibility to ensure that the client's spiritual needs are attended to either through direct intervention or by arranging access to individuals who can provide spiritual care. Specific interventions include facilitating expressions of feelings, prayer, meditation, reading and discussion with an appropriate spiritual advisor. It can also be helpful where possible to ask the dying person where they want to die, who they want to be present at the time of death and how their cultural, spiritual, individual needs can be met. Okay, thank you.